Dr. Davidhizar, in another video, you mentioned that sleep apnea is the cause of tired exhaustedness, maybe even slight depression, or even overweight. You mentioned a whole type of things. Tell us a little bit more how it comes about, or maybe not anyway, how can we detect it? What are some indications that we could have it? And what are the treatment options?
Well, it's becoming a much more common diagnosis than we ever thought in the past. More and more people are being recognized as having it. One of the problems for a lot of people is when they sleep, the soft palate, the back part of their throat, closes and they don't get enough oxygen, so they quit breathing. And of course, then they jerk themselves awake when they run out of oxygen. There are some treatments in the past. We used to actually do surgery to remove some of the tissue in the soft palate. We found out that actually didn't work that well, and so it was an expensive procedure. It was painful, had recovery time, and so that's not redone anymore. So now there's a couple of different approaches to it. One is to use a CPAP machine, which actually you strap on your face every night and turn on, and it keeps some pressure in your lungs all the time, so your lungs never completely collapse. And it's the collapsing the lungs that causes some of the trouble with this, so it keeps them a little bit inflated all the time. And so in that way, you keep breathing the whole night without any problems. The other way is there's an appliance made that can actually moves you put in your mouth attached to your teeth that actually helps hold some of the tissue in the back of your throat away to keep your passageway open so you breathe better. And that works for some people. Most people actually use the CPAP machine, which seems to work the best. But people get good results with either method. So, and it actually changes their lives frequently, because now they're not tired, they got more energy to do things. We mentioned before a little bit that a lot of people that get treated for apnea, sleep apnea, eventually become much more energetic. They start doing things, they lose weight. They're like a different person again. They don't fall asleep every time they sit down. So it makes a huge impact on their life for the better.
Now, so let's assume a person is tired and exhausted, fine. So does that mean he should include in his repertoire of examinations to check whether he has sleep apnea or not? Would that be a wise thing to do for a person?
Yes.
Okay. Now, go ahead.
Well, most frequently the way I find those people, they'll come in and say, my wife says they quit breathing at night. And that's the first tip off. Of course, they have sleep apnea. If they really do quit breathing at night, it's almost guaranteed they have sleep apnea. But we always do the test just to confirm it. But if a person comes to India tired, if they're single and living alone, they won't ever know they have sleep apnea. So you have to ask them some of these questions. If some people, the friends will tell them, well, you snore loud or something like that. That's also an indication they might have sleep apnea. So there's lots of ways to look into it. But it's one of the main reasons why people are tired.
So as a person comes in being tired, exhausted, and just not, full of energy the way he wants to be, the way he thinks, and let's say he's already starting exercising and it just doesn't work. He pops vitamins, it still kind of doesn't work. So he goes to a doctor, gets a full examination about the thyroids and about the testosterone and all the stuff working to make sure there's no organs functioning. Should he tell his doctor also, because I don't think it's a normal thing that most doctors check sleep apnea, or maybe it wasn't, maybe it becomes more common. So should he mention also, especially if nothing else was found, and say, can we do a sleep apnea test?
Yes, and more people are becoming aware of it. More physicians are checking for it too. So, there's one thing you can do too. They have a little monitor now you can stick on your finger at night that records your O2 saturations during your night when you're sleeping. So it's a real simple thing. You stick it on, and it does a little digital printout that you can get then from it, or you can pull it up on your computer. And so if you don't want to go, the sleep studies are very expensive, several $1,000s. So if you're not sure that the person is really that high likely to have it, you can have them take one of these things home, put it on when they sleep at night, and then download the information off of it. And if their oxygen goes low during the night, that's pretty much a guaranteed also they have sleep apnea without actually having to go and do the test. Then normally we would do the test just to confirm it, but that's a good way to screen for it. and increase your likelihood of getting a positive test result.
Interesting. Now, by the way, that oxygen which gets pumped in with that mask, is that normal ambient oxygen, or is it concentrated, more heavy oxygen?
No, it's room air. It's just normal air. But the reason it works is because it keeps some what we call positive pressure on your lungs. So your lungs will collapse. Every time you exhale, your lungs tend to collapse. Well, this keeps them from not quite completely collapsing. And when that happens, then it's easier to take that next breath in, and that solves all the problem. They don't have any more problems with sleep apnea when they do that. The device is, a little awkward, and you get sort of used to using it, but most people do well with it. The devices are much smaller than they used to be. They're much more convenient. They're more comfortable, so they're improved them quite a bit.
And as you mentioned, for the people who this particular device is a little bit too awkward and they just can't stand it, they can always go for an appliance, which I think, as far as I know, dentists make, and it's kind of like a mouth guard, more or less, roughly described, and then that works quite well also and is less awkward. You can toss and turn a little better, I guess, right?
Right.
Okay. Well, wonderful. One more thing, because, energy, I don't know, at least in my book, as I said, when energy goes out of your body, life just is barely worth living. So I think, and I do see lots of people with for no real good reason, having not enough energy. And they're always a little more, slow thinking, not dumb. There's a total difference, it's just a little, kind of like too much of a laissez-faire. I'm a laissez-faire guy, but, just a little too much. And I think it has something to do with I'm tired. It's getting 3 o'clock. It's getting 4 o'clock. It's, whatever. And it's just, I'm exhausted. And success in normal life, I think, is held back by people who are tired. So I think everybody should check that out. I hope you do. Bye-bye.
Bye.